دكتور عاطف حضرتك هتتكلم على الهايبرتنشن مانجمنت. اتفضل دكتور عاطف.
Thank you very much, Professor Ines Shaltut, for your introduction. It's a pleasure to work with you and with other colleagues. You give us a positive energy always for your understanding for everybody of us. My presentation will be for Novartis as a Valsartan, an angiotensin receptor blocker, as a golden standard using in management of hypertension. We know from the 100 million wellness, 100 million صحة, that hypertension may contribute to 30% of total non-communicable diseases, risk factors in Egypt. In Egypt, about 84% of total deaths is caused by the 4 main non-communicable diseases and 67% of premature deaths. If you see here, we can find that 7.7% of cardiovascular risk, more than 30% among people of 48 years or 69 years old, and the 29.5% raised blood pressure and 15.5% raised blood glucose level, 19.2% raised total cholesterol, and 9 gram salt intake. Here we know from Professor Mohsen Ibrahim long ago that poor awareness is due to the nature of hypertension as an asymptomatic disease. And the awareness in Egypt is about 38%, which is very high. The people who treated are 24%, and the controlled only 8%, which is a disappointment on those patients who will have comorbidities and who have the risk of stroke and heart failure. If you look for the hypertension management, what do the guidelines say? We can see here for the guidelines, as we see here, the European Society of Cardiology in 2018, they stated that the combination treatment is recommended for the most hypertensive patients as initial therapy. Preferred combination should comprise a RAS blocker, either an ACE inhibitor or angiotensin receptor blocker with a calcium channel blocker or diuretic. The other combination of the 5 major classes can be used, but we have to concentrate on this combination, RAS blocker plus calcium channel blocker or diuretic, which is class 1A. It is recommended also to initiate an antihypertensive treatment with a 2-drug combination, preferably in a single pill combination. And the exceptions are for frail old people and those at low risk and with grade 1 hypertension, particularly if the systolic blood pressure is less than 150 milligram per deciliter. If we look here for the, we have to start early with dual combination, and we leave the monotherapy only in grade 1 old patient and the very old frail population. The European Society of Cardiology and Hypertension recommends using the fixed dose combination, as we see here, in order to have the simplification of the treatment and the advantages of compliance to treatment. ARB plus amlodipine, for example, Valsartan plus amlodipine in 1 pill, or Valsartan plus hydrochlorothiazide plus amlodipine in one pill. And this daily pills improves the adherence, which is low in patients with hypertension. The higher the blood pressure control rates are achieved with single pill combinations, as we see, because patients receiving a single pill combination are more likely to achieve blood pressure goals than those receiving 4 combination or monotherapy. This is a single pill, and this is a free combination. We can find here the achievement is reaching 55%. Here, it is important to give this single pill combination for the convenience, the adherence, the efficacy, the tolerability, and the flexibility of the medication. In patients with newly diagnosed hypertensive patients, does Valsartan as an angiotensin receptor blocker fits those patients? If we see this case, this is a 44-year-old male presented with complaints of headache and general weakness, heavy smoker, and has a family history of cardiovascular disease. Upon examination, his blood pressure after 3 visits was 155 systolic millimeter mercury and 95 diastolic millimeter mercury. He has a body mass index of 29. Laboratory tests showed normal kidney function, normal glycemic status, and lipid profile within normal. In the MESH trial, to investigate the antihypertensive effectiveness of the fixed dose combination Cotarg on blood pressure reduction in an observational general practice settings, we take about 17,000 patients, mean age 61 years, with uncontrolled hypertension, and the mean baseline systolic and diastolic was 165 systolic and 95 diastolic, or treated, or pre-treated, or untreated, treated naive. And they are followed by 3 months uncontrolled multi-center observational study in general practice. We see here from this study that Cotarg or Valsartan plus hydrochlorothiazide, 160 milligram per deciliter, and hydrochlorothiazide 12.5 provides a double-digit blood pressure reductions. And the results from a 3 months observational study, as we see here, on all patients, there is a marked decrease in systolic blood pressure by 27% systolic, and the diastolic is minus 13.7 millimeter mercury. In the new patients or the naive patient, it was decreased by minus 32 millimeter mercury, and the diastolic was reduced by 16 millimeter mercury. In the pre-treated patients, the systolic here, as we see, decreases by 25 systolic millimeter mercury and diastolic by 12 millimeter mercury. We know that the pooled analysis of the 9 trials showed more patients achieve the goals in hypertension in less time with higher doses or with combination. We can see here the Cotarg 160 milligram plus thiazide can reach after 8 weeks by 74% control. So using this combination in single pill can control our patient more than 74%. And with increasing the dose of the Cotarg, as we see, we can reach its control by 84% on those patients. Another patient, a newly diagnosed hypertensive patient who had comorbidities. This is a female patient, 49-year-old, white woman with a history of type 2 diabetes, obesity, and migraine headaches. And the patient was diagnosed with type 2 diabetes 9 years ago when she presented with mild polyuria and polydipsia. Initial treatment for her diabetes consisted of an oral metformin with most recent hemoglobin H1C of 7.4%. 2 weeks ago, she presented to cardiology clinics with blood pressure 160 systolic and 95 millimeter mercury diastolic with a heart rate 70 beats per minute. 1 week ago, her blood pressure reading was 155 over 95 millimeter mercury. We know that there is, in obese patient and diabetic patient, there is a marked RAS activation happened in obesity and in diabetes. And this RAS activation should be blocked because it will cause increase of aldosterone salt water retention, increase the effectiveness of the circulating volume, leading to increased cardiac output and hypertension. Here, the multiple antihypertensive agents are needed to reach the blood pressure goal on those patients. As we see, we can use more than 2 drugs or 3 drugs in a single combination. Amlodipine and Valsartan show a blood reduction across all grades of hypertension, from mild to moderate to severe, as we see, decreasing the diastolic from 17, 18, and 29 millimeter mercury. Here in the Exforge, or which is Valsartan and amlodipine, provides a powerful blood pressure reduction across diverse patients types. Here we can find the diabetic patients. There is marked decrease of the systolic blood pressure by 29.5 millimeter mercury if compared to amlodipine alone. And we can see here also in the obese patients, there is marked decrease of systolic blood pressure by minus 30.2 systolic blood pressure if compared to amlodipine, which minus 22.9. We have here an experience with the Egyptian hypertensive patient having comorbidities. And this study was conducted to evaluate the effectiveness of tolerability of X-Forge combination among Egyptian patients with arterial hypertension in the real-life setting. We know that X-Forge is a Valsartan, 160 milligram, plus amlodipine 5 milligram or 10 milligram. The effectiveness and tolerability of the fixed dose combination of amlodipine Valsartan in treatment of hypertension in real-life setting among Egyptian patients was done, and we can find here we have many groups. The first group is patient with hypercholesterolemia. There is marked decrease of the systolic and diastolic blood pressure, and in the other group there is patient with coronary artery disease. As we see, marked decrease of the systolic blood pressure by 43% using this single combination, and diastolic minus 22.7 diastolic. Also here in patient with diabetes, there is marked decrease of 41.1 decrease of systolic and 21 decrease in diastolic. In patient with hyperuricemia has the same effect, and patient with history of heart failure have a marked decrease of systolic and diastolic blood pressure, and also patient with respiratory diseases, COPD. Hypertensive patients who are uncontrolled and are on monotherapy. Does Valsartan fits all hypertensive patients or will fit this patient? This is a 42-year-old man with a 5-year history of hypertension. His family history is positive for hypertension, with his mother dying at 65 years of age from hypertension. Related cardiovascular disease. At the physician visit 1, Mr. AA presented with complaints of headache and general weakness, and currently is taking a 20 milligram per day olmesartan, which is an angiotensin receptor blocker. Despite this antihypertensive regime, his blood pressure remains elevated, ranging from 150 to 155 systolic and 210, 115 millimeter mercury diastolic. We know that X-Forge in failure of single therapy study design, number of patients 894 randomized double-blind multinational parallel group study, 16 weeks, mild to moderate mean blood pressure at baseline was 150 millimeter mercury systolic and 91 diastolic. They switch these patients taking monotherapy, other monotherapy, and they give 2 groups amlodipine Valsartan 5 milligram amlodipine and 160 milligram Valsartan, and amlodipine Valsartan 160 milligram, and then elective titration if not at goal by adding the hydrochlorothiazide 12 or 25. We can see here these are the antihypertensive classes before the randomization. People taking beta blockers as a monotherapy or calcium channel blockers as monotherapy, and other angiotensin receptor blockers as monotherapy, ACE inhibitors as monotherapy, and the diuretic as monotherapy. Here we can find that amlodipine and Valsartan in both groups have marked decrease of the systolic and diastolic in all those patients taking the monotherapy after switching them into X-Forge. This marked decrease of systolic and diastolic blood pressure for 21 mean reduction. For hypertensive patients of uncontrolled on dual therapy taking 2 drugs, does Valsartan fits all hypertensive patients? Ms. N is a 42-year-old woman with a 7-year history of hypertension, first diagnosed during her last pregnancy. Her family history is positive for hypertension, with her mother dying at 45 years of age from hypertension-related cardiovascular disease. In addition, both her maternal and the grandparents had the cardiovascular disease. At physician visit 1, Ms. N presented with complaints of headache and general weakness. She reported that she has been taking many medications for her hypertension in the past, and currently she is taking 100 milligram per day atenolol, which is a beta blocker, and 12.5 milligram per day hydrochlorothiazide. Despite this hypertensive patient, her blood pressure remains elevated, ranging from 165 systolic to 170 to 105 to 110 diastolic. We have a study here in Egypt, SMART trial, showed the efficacy and safety of amlodipine, valsartan, hydrochlorothiazide as a single pill combination on Egyptian patients with hypertension uncontrolled on any dual therapy, which is an observational study, and is published online in February 2020. We can see here that the first Egyptian trial on X-Forge hydrochlorothiazide on hypertensive patients uncontrolled on dual therapy. The study objective was that the current study aimed to evaluate the efficacy and tolerability of X-Forge hydrochlorothiazide in a single pill combination in patients with hypertension from Egypt who were uncontrolled on any dual therapy. And it is 1,080 patients from 47 centers in Egypt were treated according to the local prescribing information. It was an open label observational multi-center post-authorization prospective cohort study. In this study, 2 doses of the single pill oral combination were used: X-Forge hydrochlorothiazide 5, amlodipine 160 valsartan, and the 12.5 milligram hydrochlorothiazide, or X-Forge HCT 10 amlodipine 160 valsartan and 25 milligram hydrochlorothiazide. Up titration of the dose was permitted to the higher dose or addition of other antihypertensive medications at the discretion of treating physician if the small dose was prescribed, and the study had planned to follow up a period of 12 weeks with an interim visit at 2 weeks. In this study, that it was the key inclusion criteria: the patients aged 18 years with hypertension that were uncontrolled with systolic blood pressure, diastolic more than 140, systolic 90 diastolic on any dual therapy, and to whom single pill combination of X-Forge HCT combination was indicated as per approved summary of the product characteristics in Egypt. And the key exclusion here: any contraindication in the local prescription information for X-Forge HCT, pregnant or nursing women, women of childbearing potential who were not under a medically accepted contraception method or who did not agree to use the contraceptive method. The efficacy assessment here was the primary efficacy endpoint to the mean change in blood pressure after 12 weeks of treatment with single pill combination of X-Forge HCT 5, 160, 12.5 milligram, and 10, 160, 25 milligram in patient with hypertension not controlled on any dual therapy. And here the second entry point: mean change in blood pressure after 2 weeks of treatment, blood pressure control rate, proportion of patients reaching the blood pressure goal less than 140 or over 90, and the change of heart rate, which is very important because, as we know, increasing the blood pressure, increasing the heart rate, and when you control the blood pressure, you find the heart rate is down regulated. The compliance with the single pair combination at the end of the 12 weeks. We can see here the safety and tolerability. Safety was analyzed for all patients who received at least 1 dose of X-Forge HCT single pill combination after enrollment, and safety assessment included the presence and intensity of ankle edema, adverse events, and serious adverse events, their severity and relationship to the study drug, and pregnancies. Safety tolerability assessment was conducted at each visit by calculation of the incidence of the adverse events in the frequency tables in relation to its severity, from mild to moderate to severe and life-threatening. The overall tolerability was assessed depending on the physician's assessment at the end of the study using the frequency tables. In the SMART trial, we have here all ages are concluded for the maximum 79 and the minimum is 23. Gender, male and female. The family history of hypertension was high. Systolic blood pressure 165, diastolic 100. Duration of hypertension was more than 8 years, and the smoking history, as we see, obesity, diabetes, dyslipidemia, coronary heart disease, heart failure, stroke, severe renal impairment, and severe hepatic impairment. The SMART trial results show change in blood pressure. Significant change in blood pressure was observed after 12 weeks of treatment with X4 HCT. A significant reduction was observed as early as after 2 weeks of treatment by 28 millimeter mercury, as we see here in systolic and diastolic, and 35 millimeter after 12 weeks. 8 out of 10 patients reached blood pressure goal: systolic blood pressure less than 140 millimeter mercury, diastolic less than 90 millimeter mercury, and all less than 90 millimeter mercury. The study result here, the sitting pulse significantly decreased and was observed as early as 2 weeks. And this is a good sign that the blood pressure is controlled, because if not, this heart rate was decreased, it means there is no control. So we can see here the rapid decrease and was observed as early as week 2. What about the sitting pulse? The sitting pulse here, elevated hypertension, heart rate, is a common feature in patients with hypertension and is associated with development of hypertension. In the HARVEST study using prindopril and ACE inhibitor, 15% of patients with hypertension had a resting heart rate more than 85 beat per minute, and approximately 27% had a heart rate more than 80, which is very high. Sustained elevation in heart rate over the course of the study were a strong predictor of developing hypertension. Reduction in heart rate in patients with hypertension with an increased heart rate is therefore an important goal of antihypertensive therapy. It's a sign of well control. For the safety and tolerability here, we find that the 74% of patients showed excellent and good tolerability of X4, were excellent 61% and good 33%, and the sum is 95% safety and tolerability. The study conclusion of the SMART: in this observational study, X4 hydrochlorothiazide significantly reduced the blood pressure in patients with hypertension from Egypt, not controlled on any previous dual therapy. X4 hydrochlorothiazide also showed a significant improvement in blood pressure control, with majority of patients achieving blood pressure goal of less than 140 millimeter mercury systolic and less than 90 millimeter mercury at the end of the study. 8 out of 9 patients, 95.74% of patients showed excellent and good tolerability of X4 hydrochlorothiazide, HCT. We know from this that Valsartan is the most intensively studied angiotensin receptor blocker worldwide, with the enrollment of more than 57,000 patients across all the trials. And we can see here that all the studies of mortality and morbidity endpoint of the angiotensin receptor blockers, if we compare Valsartan, we will find here that they have the value, the Valiant, the Navigator, Valheft, and the Valish and the VART. All these studies are including many number of patients who are very high if compared to other angiotensin receptor blockers. My take-home message: the Valsartan portfolio offers an effective treatment for diverse patient types and across all the grades of hypertension, with efficacy reaching up to 50 millimeter mercury in uncontrolled patients. So if we have in Cotarec from 80 to 160 to 5 X4 and 10 and HCT, we have many tools for modulating all grades of hypertension, all types of patients, all the diversities. And we here now it's time to reimagine hypertension management in Egypt through Novartis Valsartan SMART molecule. And thank you very much for your kind attention and care.
Thank you very much, Professor Atef. And we have some questions. The first question, what